So this is a new admission for Miss J in bed 5. So her chief complaint was that her ICD discharged. So her story, she's a 22-year-old female. She's from upstate New York. She's status post AICD placement and LVAD placement in August. She's on the transplant list. Also has atrial fibrillation on Coumadin. So she was in her usual state of health since her last discharge from Mount Sinai, which was in September, after coming in for the LVAD placement. She'd been doing well for the last 3 months until about a week ago when her ICD fired. She went into the hospital in Buffalo. They basically interrogated it, didn't think that there was anything abnormal with it, repleted her electrolytes and sent her home. On Tuesday, she woke up, was just watching TV, started to feel a little bit weak, a little bit of palpitations, and at that point her ICD fired again. So she went to the emergency room, and in the emergency room in Buffalo, her ICD fired 2 more times. She was found to be in non-sustained monomorphic VTAC, and they started her on a lidocaine drip. At that point, she was transferred to us last night.
Hi.
Hi.
How are you?
Fine.
So we understand that you got this heart disease during your pregnancy or after your pregnancy?
Yeah, after it.
Afterwards.
Yeah. Well, he was born in February, and I got diagnosed in May.
That was your first child?
No, second.
Second. Did you have this after your first child?
After the first one, I had some difficulties, but they couldn't figure out what it was, so.
What was the difficulty after the first birth?
Well, I was short of breath. I passed out a couple of times
After
during
the first,
activities.
so your activities were limited, you were short. So after the first child, she was already in trouble. And they didn't understand at the time what was the trouble was? Is that the idea?
And I had a regular heartbeat, but they didn't know what it was.
So you had an irregular heartbeat, you were short of breath, all after the first child. And then you get a second pregnancy. And so the myocardiopathy was there the first time, and then the second pregnancy really does it.
Were you told after the first pregnancy of the dangers of a second pregnancy, or nobody knew?
No, they didn't know what was wrong.
I see. When you the cardiomyopathy in pregnancy, 75% continue to have left ventricular dysfunction. And the 25% that they recover, 50% they have a recurrence after the second pregnancy. But if you did not recover, the chances of getting worse are high on the second pregnancy.
And so now we're going to take care of you. You can be a new heart and make you feel better.
Yeah.
That's the plan.
Yeah, I bumped up on the list.
Yeah, you're 1A?
Yeah.
That's wonderful.
Can I see that just for a second? You know, one of the problems is I don't see the venous pressure here. And I will never leave seeing a patient without seeing the venous pressure. So how do you do it? I don't see it. It's too low, maybe. Diuretics?
No, you don't take any diuretics, do you? Right now?
Aldactone.
Oh, aldactone, yeah. That's fairly new. We had the medication list in front of us. He didn't. And he kind of knew she was getting these medications. That's pretty powerful, I think. That's what I remember, mostly because I was wrong. You tend to remember the things when you're way off. But that's what stuck with me, that he could pick out the presence of these medications simply by physical exam.
So, because this may be relatively volume depleted, that's what I'm asking. If you don't see the venous pressure, the first thing to ask is if there is a diuretic. So what you do, excuse me for that, thank you very much. Thank you, are you okay?
Mm-hmm.
Yeah. You stay like that. The venous pressure is here. It's actually below the clavicle. I see very, very barely here. You see that? It's at this level. And then when you pull her up, you don't see it because it's just too low. The venous pressure is always the same. It depends the position of the patient. You see it or you don't. Here you see? You don't see it. It's too low. It's below the clavicle. You know, if I am like this, and I have a venous pressure that is like this, if you put me like this, you see, then you see it. The vertical is the same. So the venous pressure is very critical, and you never leave the bedside without knowing what is the venous pressure, because it's much more accurate than any echocardiogram or any technology that you can use, right? Thanks very much for giving us the opportunity to say a few things, okay?
You're welcome.
It's a pleasure.
Thank you.
The best luck to you.
Thank you.
But
See you later.
See you later.
she's a very spirited person. It's wonderful.
Yeah. So she's had a tough life.
Sure.
And they missed the diagnosis, unfortunately, with the first pregnancy.
Yeah.
She was sick right away, and whatever it was, it fell through the cracks. And
She
then
would
this
have
is,
avoided the second.